Want a job? Go to college. Don't major in architecture. This is, in fact, the headline in the New York Times I read shortly after graduating with a master's degree in architecture. Turns out, architecture has the honor of displacing English literature as the degree with the least job prospects. And the truth is that the perception of architecture is that it has limited value beyond being a luxury of the very rich. But trying to find out otherwise, my classmate and friend, Michael Murphy, sought out Dr. Paul Farmer, the global health pioneer and founder of Partners in Health. See, Michael had seen him giving a lecture talking about building not only hospitals, but schools and housing, all under the auspices of healthcare. And Michael saw this as architecture that could be meaningful. So he asked him what architects they worked with. Turned out they never had. In fact, they'd run the last clinic on a napkin. And so I guess with that track record, Paul saw little risk in inviting us to help design the Butaro Hospital in rural Rwanda. Today I can say Rwanda has taught me the most important things I know about architecture. But when we got there, we found out there wasn't even a word in the local language for architect. We also found out that around the world, people were getting sicker in hospitals. In the US alone, more people will die from hospital-borne infections and medical errors than breast cancer, AIDS, and automobile accidents combined. And in other parts of the world, we found where epidemics were actually spreading in the hospital. We wondered, could good design actually heal? And so we started working with doctors and nurses, community members and government officials, engineers and contractors to try and understand the challenges they faced. We found out that in one case, in rural South Africa, an epidemic of tuberculosis had spread in crowded, unventilated hallways and waiting rooms. And so at Butaro, we designed a hospital without any hallways, where everyone circulates in covered but open-air verandas. Then a study from Peru came out, and it said that sophisticated mechanical systems, like air conditioning, could fail under irregular electricity. And when they failed, so too did the delivery of healthcare. So we deployed passive systems like cross-ventilation that could be resilient in these conditions. It turns out that a patient is more likely to die in an individual room when there's inadequate oversight. So we created spacious open wards to address that. And studies in the US have shown that patients can recover up to 25% faster with a view to nature. So in this hospital, every patient faces a view of a window. But it turns out health infrastructure is about more than just the hospital building. And in Kenya, they've found that keeping doctors in these rural areas poses one of the greatest challenges. So we built housing that could attract and retain them, provide them a place of respite at the end of the day of delivering care. To put it another way, we designed the hospital to be healthy, to be effective, to be efficient. But perhaps this is what you would expect an architect to do. But then, Paul Farmer told us we needed fish ponds.
There's a term that Paul Farmer has used and written about for the last 20 years. He calls it dignification. The idea is to make a statement creating dignity in those communities. That might be as simple as landscaping and putting in a nice garden and a fish pond.
Abarwayi ukabona akajaride naho hakabafasha icyo nacyo kigashimisha ni nziza cyane kandi numva birashimishije.
Beauty is important per se, but beauty that provides you with dignity. Beauty that what we call in French transcend, pull out of you the best thing you have for yourself and for giving to the world.
Everybody desires beauty. At the time we see something and we like it, when it's beautiful, the way we see things may change. And I saw how the patients and other people in the region treat the hospital. They remove their shoes when they're going to enter the wards. It's like entering their own houses. It's beautiful.
So Amelie's been working with us for the past couple of years, and last month she graduated as valedictorian in the first class, in the first program of architecture in Rwanda's history. And I think she put it pretty well, which is to say we have to start by rejecting the notion that some deserve the full benefits of architecture and others only the bare minimum. We have to uncover the locally available resources to go beyond the bare minimum. But more often, I hear it a different way. I hear people say, I can't afford beauty. I just need a building, or the bare minimum. And so we went out to uncover those resources. We started by traversing the countryside. At the base of these volcanoes where some of the only gorillas in the world still roam. We kept coming across these piles of volcanic stone. For us as outsiders, this stone was beautiful. But for the Rwandans who had to laboriously remove it from their fields, it's a nuisance with little value.
naho buri twubakaga ibyondo umucanga aya hariya ntabwo twiye tuyubakisha nyara twayubakishije gusa kuri masi hariya.
In a lot of our designs, we'll be using materials that people are usually using, but in different ways, pushing for innovative ways of construction. So how do we give more value to materials that are usually considered as worthless?
ikintu kinshimisha ndi n'ahantu uko abantu tuba duhura bakavuga ngo nakoze ibintu byiza hano iri haya makoro.
Everything that we used before was something that has to be imported. It's like steel, the cement, the glass. But we can do something very beautiful that is originally Rwandan. So the way these stones has transformed the whole region, the image of Rwanda, the image of architecture of Rwanda, for me it's something very beautiful.
Jean-Paul is another one of those recent graduates. The thing I take away from what he said is that uncovering those locally available resources is about more than cost effectiveness. It's about finding the opportunity to have the greatest impact in the region. In Rwanda, one of those resources is that the cost of labor is low relative to materials. And this creates an opportunity for customization on an almost unimaginable scale. We can customize every window, every door, every piece of furniture to be not only optimized to its purpose, but beautiful as well. And this is also an opportunity that can create a lot of jobs in the region. In fact, 4,000 people built this hospital. But of course, masons like Hakiza and Anne-Marie don't exist everywhere in the world. But the point is, these opportunities do. We have to constantly ask how the choices we make can have the greatest impact in the communities we serve.
It's actually about rethinking the building itself as an opportunity to protect and inspire the imagination of a community to something better.
This hospital was for the people, and the fact that they sweat to make it, they own it far more than if we were just giving them a key.
What we're trying to encourage people through our projects is we're not bringing things to give you. We have things to trade. But we want the skills you have. We want the dreams you have. We want the passion you have.
There's this catalytic effect. As finished, many of them have the skills to go and start their own business or find another construction project. You've now got a place where middle-class professionals are moving to, and so suddenly you got this recipe, and when it all comes together, you see massive economic development.
It's something which is important to see everyone involved. And the more we get involved, the more we make those bonds and the more we live in harmony.
I would like to see these masons going to Congo and build these beautiful walls there. And I would like to see Congolese carpenters come to Rwanda. We've been constantly asking ourselves, is this all that architecture can do, or can it do more? The question to myself and to every other architect is, how can we use architecture to contribute to peace?
Now, this is an audacious idea. That architecture could contribute to peace. It's not something I ever could have imagined. But these guys are driven. Commode and Christian, who you saw before him, before there was a program for architecture in Rwanda, they left for Shanghai. They learned Mandarin a year. They got their college degree there. Then they came back to work with us on these projects. And listening to them talk about it makes me believe in it. Working together, we've seen that architecture is about more than just a building. It's about the process and the people that create it and the impact it has. We've seen we don't have to choose between the bare minimum and something better. We've seen that when we uncover the locally available resources, it doesn't have to be expensive, but it can be beautiful. And when we invest in the communities we serve, we can construct both dignity and lasting impact. Now, more often than not, we see buildings displayed as the vision of a sole visionary architect. But I wanted today for you to see just some of the people and hear their voices that make a project like this possible. Since Butaro, Mass has grown to work in all parts of the world, in places like Haiti and Liberia and the United States, just to name a few. We worked on everything from individual buildings to national policy. We've worked in some of the most rural villages and some of the densest cities. And we've seen that in every project, in every place, these same opportunities exist, but it takes a commitment to uncovering them. It's as relevant here in New York as it is in rural Rwanda. So the question is, will we expect this from all of architecture now? I believe the future of our cities depends on it. So the next time you look at a building, will you assess it at a glance? Or will you peel back the layers to examine the processes and the people that created it and the impact it has? Because just a couple of years ago, there wasn't even a word for architect in Rwanda. But today, architecture is meaningful. Architecture is powerful. Also has a word. Umahanga, Mugahanga, Inubako. Thank you.